Me. Thank you. There we go.
Oh, I could put you in the waiting room. Oh, I can make you the host
Don't
too.
put me in the waiting room.
That's hilarious that I could put you in a waiting room.
I sit in my therapist's Zoom waiting room sometimes, and but I'm there by myself. It's fine.
You're just like, I'm just gonna do this until the
Yeah,
therapist
but
is
then like
turning.
I never know when I'm being let in. Like there's not like a ding or anything, so I could just be like fucking around, and all of a sudden he's there.
You're like, oh hey, sorry.
Whoops. Oh yeah. Okay.
Is
Uh,
it you?
what?
Is it working for you?
Yeah, it's working. It's recording.
Okay,
I have a little blinky dot.
you're good.
Yeah. Okay. Just for the record, what's your name?
My name is Grace Rossow,
Okay, Grace. And where were you born?
born in Nagpur, India.
Where is Nagpur, India?
It is about 7 hours east of Mumbai, India.
Okay, great. How did you end up in the States?
So I was put into an orphanage at 2 weeks old. During my time there is when my parents applied to the orphanage in India, and that is how my family and I got connected. And from then on, it was just process of paperwork, the home check for my family, making sure I was going to a good home. And then at 13 months, April 7th is when I arrived at Lambert, St. Louis, which is the airport.
Thank you. Um, what happened while you were in India?
So while I was in India, I contracted polio somewhere between 4 and 9 months of age. We don't totally know. The records are very vague.
What impact did polio have on you growing up?
So for the major physical impact, it paralyzed my left leg, partially paralyzed my back. So I wear a leg brace to walk with. Um, Emotional impact wise, not too much. I never really got bullied for having polio, but I also was very open about the fact I had polio. And then surgery wise, medical wise, I mean, I had a lot of surgeries, 18 in total, 15 orthopedic surgeries. So being in and out of the hospital pretty regularly, doctor's appointments. But in my world, that was normal, so it didn't seem too weird.
Great, thank you. Do you want children?
No, never. I have two perfect cats.
Do you have any resentment, ill feelings about that choice, or have you made peace with it?
Oh, I never wanted children in the first place. Um, every so often, the hospital Shriners would remind me and say, hey, if you ever wanted to have children, you would be high risk. It was never really something on my radar growing up. I kind of thought, oh, I like to play doctor. Oh, I wanted to, do something in medicine. And so I never thought having kids wasn't ever really on my radar, honestly. I was in a relationship for a while where my boyfriend at the time was unsure about him wanting to have children. So that was definitely a stress for us, but it definitely I ended up making the decision that I did not want to have children and being very steadfast on that.
Okay, great. So, what was your journey like into the medical field? How'd you get started? How'd you end up where you are now?
I mean, I definitely think having polio is the reason I ended up in medicine. When you grow up kind of in the hospital, having surgery, procedures, just around doctors all the time, you get interested in what's going on. So I think also that had a lot to play into it, but I think also I wanted to do good for other people. I wanted to help other people in the way that people helped me growing up. So medicine was kind of the natural way to do that. And I also people know me growing up. I've always been very interested in how the body works, what the body does. Having such extreme exposure to orthopedics was really interesting because I really got to see how the skeletal system, the muscular system, and the neuro system all work together, and in my case, don't work together. So it was kind of just so logical the logical thing that happened. Like, I don't see myself in any other field.
So what about your time at the fertility clinic? How did you end up in that particular job? What was your function? And how did either your friends and family feel about that and the fact that you didn't want children, or like how did people react to that, like finding out that you were someone that didn't want children but like took a job at a fertility clinic?
So one of my best friends from high school, Mariah, actually helped me with a fertility clinic job. She's an employee there. We needed another patient coordinator, which is similar to a receptionist, and she helped me get that ball rolling. I would definitely say it shocked some people that I was working in fertility and did not want children. But the way I explain it to people is that just because I don't want children doesn't mean that I can't help someone achieve that dream of theirs. So it definitely made it very interesting. It was hard at times to sympathize with the patients and empathize because I did not have the same desires they did. But at the same time, it was also really cool to see someone achieve this dream that they had, been wanting for so long and had tried so hard to get. And patients bring the babies back after, several years of trying. That's the coolest feeling ever.
Because like you have like this whole formed human that you created there, right?
You do. I actually nixed this part from the interview,
Okay.
but just for you, I had a patient actually just recently. She texted me in the middle of their ultrasound, and she's like, "Hey, my partner's pregnant," and she's a same-sex female couple. And I was like, "Oh, that's awesome." And she's like, "By the way, the reason we're telling you is that the embryo was created while you were still there."
Oh, that's so nice.
So obviously that has to be nixed because it'd be fairly easy to figure out who that was.
Got you.
But
Yeah,
it's a cute story.
that is cute.
Yeah, and they're so sweet too.
Um, okay, so we hear stories a lot about women fighting with their doctors to get, have the right to choose not to have children, to either have a tubal ligation, or in some cases, if it's medically necessary, a hysterectomy, or just facing questions about whether or not they do they really want that like 10-year long acting IUD. What kind of experiences have you faced with that for yourself?
And
Any?
honestly, I've been very lucky. I went on continuous birth control when I started college. What's funny is what prompted that question to the university nurse practitioner was the fact I was going to India and I didn't want to have my period while I was in India. And she's like, "Oh, hey, you can just take birth control back to back to back, especially if you don't want a kid, and it's really not going to be that detrimental to you." So that's how I started on birth control. And then when I graduated, I had to get a non-university, primary or physician. And so I just called up the local OBGYN office and said, "Hey, I need to establish as a patient." I talked to my doctor and I was like, "Hey, I'd like an IUD." And she's like, "Sure, perfect. Come in on this day and we'll put it in you." So in that respect, I've been very, very lucky with um, just reproductive care, but having physicians that are very supportive of reproductive care. Um, but unfortunately, that is not all women's experiences.
So have you had any experience where you've said like I want an IUD and they've said it's your best 7 years of childbearing right in front of you, or anything like that?
The only thing I can think of that was really blatantly a physician being like, "If you think about having children first," was my breast reduction surgery. Actually, my plastic surgeon was a male, and his first words, and I don't necessarily think that they meant to be malicious, but he said, "Do you ever want to have children?" Because the thing with breast reduction surgery is if you have it done before childbearing, you have a 50% less chance of being able to breastfeed. Now, for some women, that is very important. And so medically, that provider brought it up because if I was someone that really did care about that, and I did not have the ability to breastfeed after surgery, that could be something that was very, very detrimental to me. But at the same time, the way he did bring it up was just very, he did not approach it well. And that is something that I think physicians, male physicians especially, do not know how to approach with women. You don't just ask someone, oh, do you know if you want to have kids later? He didn't really explain to me why he was asking the question in the first place, which would have been obviously a much better approach.
Fair enough. Do you think that you haven't had pressure from gynecologists over having children because of having polio as a pre-existing condition?
110%, honestly, yes. I have also been very vocal with gynecologists very early on in appointments, and I have a habit of screening my doctor as they screen me. I ask them certain questions about their medical practice, about how they treat certain things, because if I find out a physician is anti-abortion, or if I find out a physician is, anti-reproductive care for some reason, I'm going to fire that physician and find someone else that's going to be able to support me. I, as a disabled person, can't have a physician that, believes that their view is more important than my reproductive health.
So, do you think you are so outspoken and like so assured of yourself when taking care of medical things because you grew up in a doctor's office, or is it because you like work in the medical field so you know how to talk to them? Where do you think that comes from?
I think it's a mix of both, truthfully. A lot of it has to do with growing up with very supportive parents. I joke about my mom being funny sometimes. My dad's a little odd, but you know what? Whose parents aren't funny and odd? Every parent has their quirks, but my parents have always been 100% supportive. They never pushed me to, feel like I needed to have children. They never expected me to have children, for the purpose of grandchildren. Shriners, as my physicians there, were always very supportive. What they expected out of me was to be informed about my medical care. And so going from that at a very young age, it definitely helped me advocate for myself as a patient. And then absolutely being in the medical field, working on the employee side at doctors' offices, and especially in OBGYN and breast health. I did a stint there, and I did my bit in fertility. You definitely learn how to advocate for yourself. You learn how to, you learn how to talk to physicians on a different level that I think a lot of lay people don't have, because it's very different when you see a physician once or twice a year and you know them on a very superficial level versus a physician on a much more personal working level. When you're invited out to dinner with them, you've done more personal events with them, you actually know how to interact with people a bit more. And especially just learning medical terminology and having the ability to actually speak in their language, unfortunately, I think does benefit people.
So then what would your advice be for a woman who needs to advocate for herself in the doctor's office with a doctor that she only interacts with superficially?
In all honesty, if you're not getting the care that you feel like you need, or you don't feel like your doctor is listening to you, I would fire that doctor. I would find someone new. I would find a second opinion. Unfortunately, there are a lot of cases of physicians not listening to women. There are cases where a lot of physicians just say, oh, it could be related to that time of the month. Oh, it's not that big of a deal. They just brush it off. If that happens, find someone new. I fired my neurologist at 15 years old, and my mom was not happy with me. And about 2 months later, we figured out what was actually wrong with me, because I got a different neurologist who actually had some semblance of knowledge, at least to how I feel, and figured out what was going on very quickly in about 2 visits with her. So obviously that's not reproductive related, but you do have to advocate for yourself. It doesn't matter who the physician is.
And how do you have any advice on how to like best do that in the room if you can't fire the person?
I mean, it really depends. And I'm a very snarky, very sarcastic person. I will call people out, but unfortunately, a lot of people won't. A lot of people do view doctors as an authority figure, and they are very scared to speak up, especially if they've had this doctor for a long time or they like this doctor. I think the important thing that people do need to know is that your one doctor is not the only doctor with that knowledge. You may like your doctor, but it still may pay to get that second opinion just to say, hey, you know, I talked to this physician, they view it like this, what do you think? And maybe that doctor will say, oh yeah, that is a good approach. I didn't, think of that approach for some reason. Every doctor has different schooling, every doctor has a different, way of viewing patients and viewing medicine. I've seen two doctors in the same field write drastically different notes on patients. They were both correct in very different respects, and it just depended on the person. Another thing I think to remember too, and it sounds odd, but doctors are people as well. You have to remember, they have bad days just as much as the rest of us do. I've seen physicians who, found out their father had died 20 minutes ago and continued on with clinic. That's their day. They don't stop seeing their patients just because of that. So sometimes I try to remember, maybe if my doctor's not in a good mood one day, what's going on in her life? Like, did she just find out a family member passed away? Maybe they had to put a pet down, a couple of days before. Her life's not just perfect because she has an MD after her name.
Yeah. Cool. Thank you. That was all of my questions, and that got us plenty of material. I on my end, I had a technical glitch in the middle of one of your answers. Is it okay to ask the question again?
Oh yeah, that's fine.
Okay. Oh, what was the... do doctors, especially gynecologists, do you think that they never bothered you as much about having children because of your pre-existing condition?
Oh, 110% yes. I think just because I was very vocal about the fact that I didn't want kids very early on, I had no interest in it. But also I think the fact that all doctors had told me, yes, children are going to be something that's harder for you to attain, and it wasn't something I showed any interest in ever. So I think a lot of doctors just didn't feel the need to question it too heavily. I've had OBGYNs who have asked me before, and I think it's obviously appropriate if an OBGYN brings up that question, because that is their department. But luckily, I've also had every one of my doctors has also just left it at that. When I said, no, I'm not interested, they said, okay, cool. If you ever are, you may bring it up with us. And I got very lucky in that respect. Unfortunately, most women do not get that level of luck.
Okay, there we go. We got it.
Yay!